hybridly. And then also kind of the purpose of this is to brainstorm meaningful and effective resources that might not be currently existing or currently thought of in the community. So what are we already working on? So that you know that we're trying to do something and we have some bark to our bite, or bite to our bark. So we are working with CADASIL and BERT to revamp the doctor directory to make it more accessible, to have it updated, accurate, and also more inclusive, as well as coming up with better options to easily submit doctors who are good and experts who might be in your area. Personally, I'm hoping for at least a specialist or a knowledgeable doctor in every state, but we will see. We've also been hosting some educational webinars for the community, and then also we've been working on CADASIL advocacy and awareness, trying to inform the medical community and others about CADASIL. So these are just some ideas that we came up with, but we're research professionals. We are not living your daily experiences. We don't know what the struggles are. We don't know if these are quite applicable to your needs, but just to kind of get ideas flowing, we've thought about maybe support groups kind of stratified by different experiences, perhaps support group for somebody who is at risk for CADASIL or is affected by it or is a caregiver or is a family member who didn't inherit it, all those sorts of things. I don't know, maybe that's not how you guys want to do it. Maybe you guys want to stratify it by age or something else, but we're here for you guys to tell us what you guys need and want. Yep.
Where are you looking to form these support groups? Because on Facebook, there is a support group for patients. There's a support group for people who are at risk. There's a support group for caregivers.
Yep, exactly. So those support groups on Facebook are great. However, we're thinking about maybe having a live support group where it's over Zoom or maybe even hybrid. Those are amazing resources and probably the most common things we hear from people we work with in the community that they find the most value of that or have made the most connections. So how can we build from that? Also, maybe community outreach events in the future where we are gathering in person more. Is that something you guys want? We don't know. Having a family advisory board for our study possibly, caregiver resources, and anything else you guys are thinking about. I also failed to mention at the beginning, there's a QR code in the corner if you guys want to scan it and anonymously kind of give your input, so be it. If not, that's fine. So these are some of the folks currently working in the CADASIL community to help further everything. So I just want to say a huge thank you to all these folks who are helping to make strides in this community. And then these are some available resources currently. I am not sure why the font kind of ended up like that. That's not how I edited it. But Cure CADASIL, everybody knows, is a very, very amazing resource that has comprehensive information and other resources. The Cambridge University hospitals are based out of the UK, and they offer a hybrid conference every year and also have a wealth of information on their website. The Rare Care Assistance Program provides patient assistance in the form of financial and other sorts of support for folks who are living with rare diseases. The CADASIL Eradication Project I think there's actually a gentleman who was in the morning session here, is trying to help figure out this from a genomic standpoint. And then also the Facebook support groups are so valuable for linking this community with rare diseases who are spread across the world. In the corner too is a different QR code. I know, I'm so Gen Z with my QR codes. That offers a whole list of other resources, and we can provide those resources to you later as well. So this is the link to the QR code that was on all of those pages. If you guys have any ideas, I'll leave that up. But for now, I want to talk about your ideas. I want you guys to share them with me, to tell us what's missing, and maybe we can figure out how to form solutions. Thank you. Do we have anything in the chat?
No, just a comment to probably pass the mic with the questions because they weren't able to hear the question.
Okay. All right. Thank you. Can I give this to you, Bert, on this side, just to pass one way or the other? And Erin, can I give this to you on this side, one way or the other? So Me standing up was kind of formal, and I don't want that. And if we want to move closer together, that's fine. But what can we do to bridge the gaps? Or what are the gaps? What's missing? What do you guys need that you wish you had when you first kind of were thrown in this community? June?
Just want to ask a question, Megan, whether, how related to the research do you want this to be? In other words, is the end goal to enroll more people in
Nope.
studies,
Or-
or is it to, thank you. Yeah, the question is, how related to advancing the research should this be? Or is it generally how we are challenged in living our lives? Or those of us who've been diagnosed or have family members diagnosed?
Thank you, June. So, oh, I have one. Yeah, sorry. So close. So I'm taking off my consortium hat. I believe that by participating in research, whatever study or studies you may choose to participate in, you are doing an extremely selfless act and giving up your time, your, energy, your blood, for research. And the goal of this is how can we give back to make your lives better, So if research is part of what can help you, I would like to address it, but it's more holistic.
Okay, so since I have the mic, and I'm just for a moment, I'm going to pass this along. I can think of two things that would have helped me.
Okay.
And I don't know if that's what is useful to anyone else in the room. So I'm open to you guys shutting that down. But two things that would have helped me. And to some extent, this has to do with outreach. A very, very wonderful doctor, a neurologist who specialized in multiple sclerosis, was the one, thankfully, who diagnosed me 9 years ago. I could not have hoped for a more wonderful doctor, but she wasn't particularly informed about resources, nor was the staff at Mount Sinai at the time. And so I had to find out, and you might think this is obvious, you just go online and do a search on CADASIL, but I really wandered around the internet a little. It wasn't as productive. So nobody handed me a list to say, here's where you can look for information. I just think a starter kit for patients could be helpful. It would have saved me time, and years later, I find this incredible wealth of compassion and experience and knowledge, and it might have helped me years earlier. And just for context, so I'm the first one in my family. Now a number of you know this because I've had a chance to get to know you, but I'm the first one in my family who's been diagnosed with CADASIL. It wasn't like there were generations to think about and connect with and put the pieces together. So I was really starting from scratch. So that's one. And the second thing, and I'm sure for all of us, it's many things, but I'm just going to pick two. The other thing, Dr. Lahi put a slide up today. I wish I had gotten a screenshot, but I was in too much awe during that whole presentation, and I hope we'll have access to the PowerPoint. She listed the experiences that people were having, fatigue, and whatnot. Not to put the cart before the horse and say, well, if I had that list of complaints or experiences or challenges, now I know what to look for. But even as someone who's lived with this for 9 years and I had 3 strokes that I know of. It's really helpful. It would have been helpful for me to know other people are experiencing this. Not that there's ever one list that covers everything, but it would have helped explain things to me, because if you say, well, is this challenge I'm going through, is that due to CADASIL or not? And a doctor might say, just figure it is. But it's helpful to know what's happening in the world. I'm on these Facebook pages too. but I don't know, I'm sure I don't know enough because we're all learning.
Thank you, June. Kind of on top of that, and I know Erin also earlier talking to me suggested some kind of a doctor's kit or info packet for newly diagnosed. What would you guys want in that? What is helpful?
Can I just, that's a great idea. I'm sorry. I think a kit is a great idea, but I think having places, like you went to Mount Sinai, that's a great hospital, and you well, I don't know, maybe you didn't get such great, you didn't get such great.
Not that it wasn't a great hospital.
Yeah,
But nobody was
you didn't,
prepared at that
right.
time.
And hopefully there is more information out there now. And I just like to say, when my husband was first diagnosed in 2011, and you searched for CADASIL, you found this article that said life expectancy was 20 years after diagnosis, which was like a horrible thing to have to read. So if someone was diagnosed with CADASIL by a neurologist and they were able to be directed to centers of excellence where they could go and get the latest information that they could then bring back to their neurologist, who maybe doesn't know that much about it, because maybe if you're living somewhere in Missouri or if you're not in a major city, you don't have access to the best facilities, and let's face it, healthcare is not equal in all places. So if we could have those centers where patients could initially go and be directed by their doctors, so their doctors would have to know about these places, and then bring back information to their doctors, I think.
I'm sorry to interrupt, but we have Cure
Do you wanna-
CADASIL, but nobody told me, sorry. We have Cure CADASIL, which is amazing, but nobody directed me to that. And I didn't find it on a search online.
Exactly. This is exactly what I'm saying. So if someone went to one of these centers of excellence and got a brochure on Cure CADASIL, a pamphlet on the consortium studies, and whatever other latest news was out there, that they could then bring back to their doctors and not bring back one brochure or one pamphlet, like a stack full, so the doctor has them for future patients,
Thank you.
Well, a couple very good suggestions. The concept of centers of excellence is fantastic. The coming up with how to find the centers of excellence, what's the definition, is a little more
There
difficult.
are 12 centers that are doing studies
Right.
that are very well informed
Right.
about CADASIL.
I do want to say too, there are even more than that right now with Mount Sinai and Manhattan and the NIH and Bethesda and also the Mayo in Jacksonville.
So how
So
many
there's
are we at
15.
now?
15.
Well, no. Well. So it's just
Now,
a
where,
goal.
where this has been done in other fields of medicine, often groups of experts, whatever, get together and they say, well, we should have a social worker, or we should have, so one way to define it is by having the means to care for patients. Whether how good they are or not is harder to judge. But at least you have this person, you have that person, you have, and all of them are at your institution. And that would be maybe requirement number one, and then on down the list. The other one that's often used is volume, of course. If a center sees 2 CADASIL patients in a year versus 25 new cases in a year,
Right.
you might think the one that sees 25 would have more, expertise.
But so what I'm saying is if we used the consortium centers as centers of excellence, they already are aware of it. And because the studies are being done there, I'm assuming that the neurology departments in these facilities are a little bit well informed than others around the country.
Yes.
But-
A couple of thoughts. I think that we're trying, a center of excellence in medicine means something very specific, and it includes a lot of criteria that have to be met, but I'm not sure that that's exactly what you're talking about. I think you're talking about having resources where there's verified expertise. So not necessarily having to become a center of excellence with all of these criteria that most health systems might not be able to produce right now or want to invest in because the population isn't such that it would support that kind of an investment, unfortunately. So getting awareness out there, I think with a list of medical centers and providers that are at least informed would be an important first step in that direction. Another thought, as you were talking about centers of excellence, I thought, how could we leverage centers of excellence that are existing already and kind of back this in instead of starting out front, back it into existing centers of excellence for stroke care and have it be an add-on to that. Because those are out there already and there's established criteria for those already. And just have it be something that could easily be added, I say easily, maybe not easily, but could be added on to existing stroke centers of excellence. I'm not sure if anyone else who's stood up a center of excellence or been part of that has any thoughts in the room about how that might look. And another thought, while we're at educating doctors and increasing awareness, is that the point of entry for most people is their neurologist or their physician, usually a neurologist. With CADASIL, I'm thinking, based on my limited knowledge, since I'm very new at this, but I'm wondering if there's a way that we can get in front of them in a meaningful way at maybe their conferences, to provide some sort of a very, just down and dirty fact sheet, or just do a poster at neurology conferences and have that be part of their continuing education, so that they're at least more informed. And another idea that just popped into my head as we were talking and knowing that Madison is near the headquarters of Epic is why not come up with some sort of a clinical decision support tool that's embedded in the electronic health record that would pick up on these symptoms as a cluster and suggest the possibility of a CADASIL diagnosis, even for physicians who are not informed and don't seek out this continuing education. It could be something that arrives at them in the clinic through the EMR. So we meet them where they are without hardly any effort on their part. I know I just spit out a whole bunch of things, so my brain's been working.
And kind of thinking about these resource centers or potentially tacking on to centers of excellence, besides neurologists, what sort of professionals are you guys looking for and needing?
Sorry, we were just talking about this. ER, when somebody presents at the ER and they kind of need to know what they're looking at or what to look for. Primary care physicians, they see a lot of people with a lot of different diseases, but this has got so many components to it, and it can change on a dime. So, how can we educate the primary care physicians, the neurologists? Tom spent many visits at a cardiologist because they were convinced it was AFib. It had to be. What else could it possibly be? Well, it was CADASIL. So I know it's going to take a while. This won't be done overnight, but getting everybody in the medical community on the same page, and then how do you keep them updated so they can say, hey, I want you to be tested for this, but you can read a little bit about it or not, but there are great things going on, so give people a lot of hope. because I know, back 6, 7 years ago, there was really nothing. And Tom just closed the computer. He's like, I don't want to read about it. So I think it's also showing the doctors that there's a lot to be hopeful about, not just go on your way and live your life,
Speaking of that, a nice resource as someone who's newly diagnosed would be a vetted list of resources and things that you should read to keep people out of things that don't inspire hope. Not that those stories aren't important, but if you go online and you just Google something, you're going to come up with, probably like all we did, the worst of the worst stories, and that doesn't inspire hope at all. And if there were a way that we could direct people to some information that's in a consumable format for people who don't have a medical background, that would be extraordinarily helpful.
So it sounds like what you're saying is, how do we get people to come to, say, Cure CADASIL website where they might find this information, a kit or the centers of excellence, for lack of a better term. I don't care what you call them, but just places where people can go to get good information. How do we get them
To go straight there.
Yeah, like how do we get people to go to Cure CADASIL and get this information? I don't.
Not to throw you under the bus, but June, from a marketing perspective, how do we do it?
I'm sort of right now immersed in thinking. I'm happy to address the marketing question, and having spent like 40 years doing this professionally in corporate America, but can I, if it's all right, I'd like to jump on something that Barbara was just saying. Well, not directly, but something I'd like to queue up on the agenda for further discussion at another time, in terms of missed opportunities and resources, and speaking about the upside of the tremendous innovations and incredibly talented and dedicated professionals who are helping us and our families move forward on this, which is not just gloom and doom and dire the dire things we come across on the website, but I can say I got a bit of, if not misinformation and poor information, you don't have to be in the throes of depression to still benefit from some guidance. Even somebody with a bubbly personality can benefit. I was given some bad advice, actually, and when I think back to Dr. Elahi's presentation today, because I think it was full of just so much wisdom, and she doesn't say it as, here's, something everybody should know, but embedded in what she said was a lot of wisdom. So, for example, and I apologize, this is a bit of a diversion from what you asked about.
No, this is great.
Megan.
I don't
But two things that I think were, and there was nobody for me to reach out to. And even, again, Mount Sinai is a wonderful place, and I went to a support group of other, primarily women, in the MS group who had to leave their careers for their diagnoses. I went to not a well-qualified professional, but my insurance said, here are people who you can speak to in your community for, they were probably MSW, so social workers, not psychologists or whatnot, but one woman who said to me, whatever you do, don't leave your job. I was struggling. I was having terrible migraines, like to the point where I was hoping I could get home. I took 2 subways to get home. Then I got to a train station. I either had to walk a mile or drive. And at that point, you've had migraines. Like, you don't know if you're going to survive them. That's because they get that bad. And so she's like, whatever you do, don't leave work. I had to leave work, and that made it much worse. My doctor said to me, it's no longer safe for you to work. You need to explore disability. And again, I don't know if it was James who said it this morning. So I got rejected. I had to go up for Social Security disability, got rejected 3 times. You have to go 3 times. Luckily, I had a long-term care policy that I'd purchased. But they still want you to go through the process. So the don't stop working whatever you do was terrible advice for me. I didn't start getting a little bit better. I didn't stop having massive migraines till I stopped. I was a senior vice president in a global corporation, and that supported my family. I got 2 kids through college and whatnot. Not working was a big decision. So terrible advice. And the second piece of advice that I think people meant well, but and I've discussed this with some people in this room, which was I had a brief session of genetic counseling, and at the time I was diagnosed, I chose not to tell my children who were over 18, but still, not necessarily what I would consider in adulthood. And they said, oh, you have to tell your sons, and I said, yeah, I just don't feel like this is the time, and there's a lot that has to be done in our family and understanding. And anyway, they're going to resent you the rest of your, and I eventually, the first son that I told said to me, Mom, you could tell me anything. And didn't resent me. And then the son that I told years later, my older son actually, who I knew was not prepared to absorb this at the time. And I told him years later, and he thanked me, and he said, Mom, I'm so glad you didn't tell me right away. I wasn't ready to hear it right away. My family is still really grappling with this. They see me relatively healthy from their appearances, because they don't live with me anymore, right? And my younger son sees me with his children and thinks I'm the most energetic among all the grandparents and all the older relatives, So I'm trying to cushion them, but the advice of you must tell all the members of your family now, it wasn't right for me. There's no blanket decision, and there's no set instructions. To be able to have worked with a professional, a counselor of any kind, who could have been a little bit more open-minded, to say, there's no one way, and let's help you in a way that is appropriate for you as an individual, would have been so beneficial. I struggled with so much of this, because I think we all do, even as loving spouses and parents and children. I took care of my mother, who didn't have CADASIL. I took care of her till her last moment. I moved her to my community, and then I moved her into my home. I mean, we do everything we can. It's hard, and it doesn't mean that we don't do it with a full heart, but it's still hard. We don't have the experience, and there are few people to turn to. And getting bad advice, getting advice that wasn't aligned with me as an individual, was actually harmful. I struggled for years, having left work, having to deal with leaving work, having to apply for Social Security, and then not having an income. You're going through all this medical stuff with no income. So, I don't know, it would really be great to have people to give us some guidance.
And just to think concretely, is that something that you guys are interested in, how to manage and navigate that disability, Social Security, moving into your new stage of life?
It doesn't get better than Dr. Elahi and Dr. But there is still, and Dr. Elahi mentioned, if you may have the great advantage of being able to afford or find an agency to help you coordinate care. I was looking for that. I was taking care of a very sick husband and couldn't take care of myself, and all these things come up, right? It's both as a result of CADASIL, and if we're blessed to be aging, then you start encountering other things. And I was told at Mount Sinai, my insurance didn't cover any coordination of care. There was not even a social worker who could speak to me. And you have so many questions, and where do you turn? Nobody else in my family has been diagnosed. Most don't even know about this. I don't know. We desperately need some people to say, here are some starting points. And even going through 3 times in front of Social Security, not fun. And I got rejected all 3 times.
Thank you.
You're suggesting that that's something that the consortium could offer, would be services for someone who's trying to get disability?
Well, I don't know if we could, help coordinate that personally. I think that's a little bit above my pay grade in terms of making those sorts of decisions. But in terms of getting a printout or a resource that is some kind of tangible thing and kind of, step by step, don't be surprised if you get denied 2 or 3 times sort of thing, so that you don't get super discouraged. I mean, it is discouraging, and I can't even imagine kind of what folks who have gone through that felt during that. But, if you hear other people have kind of gotten it after trying twice or 3 times, you might be more likely to try. But if you don't know that, you don't know that.
Yeah, we were just in another seminar where they did say, get a social worker, because they're required in rare disease and insurance. So if they say no,
The
make it
insurance
happen.
case manager, yeah.
Yes, a case
Ins-
manager.
Insurance case
Um,
managers, which I did not know existed.
Right.
But they can help manage the insurance of your, like the different providers and getting things approved, like if you need medical equipment or things like that. And the social workers whose session we attended yesterday was saying that if you, like everything with the insurance companies, you need to fight. If you fight hard enough, because this is a rare disease, they're more likely to give you an insurance case manager, which I guess is a newer kind of position and role.
So you get that through your insurance company?
Yes. Yep. You call your insurance company, because that was my question too. How do you get
Yeah.
someone who is like this beacon of light in the mess that's insurance?
Question about that, you represent the insurance company.
Yes. Yep. I think it's more of a resource to help navigate.
Yeah.
That's what it seemed like. Which.
There's a question in the chat, so I will ask it. We know that depression and anxiety comes with this diagnosis. Is there support with regard to this to help the patient understand they are going through something normal based upon this illness? And shout out to Erin for supporting her brother who was recently diagnosed. I do want to approach it, we're in this chat setting. We're not all medical professionals sitting here. We're having an open conversation. So I kind of want to approach this maybe getting your methods perhaps on how you deal with depression or anxiety, or maybe kind of talk about what you do to manage.
What sort of resources are you looking for to get that support?
I think the first thing that I think that we should do is destigmatize it and let people know that this is something that happens to almost everyone, if not everyone, who becomes diagnosed, and it's not a problem with them as a person. It's not a character flaw. That it's expected, and you're okay. It's okay to be this way. Others are like you in this way, and we need to encourage them to be connected with professionals that understand. As you were saying earlier, it's important to be connected with someone who understands the implications of the decisions that you're making, from a genetic standpoint, from a decision all the way to decisions about things that will change the course of your life. Giving up a career as a career woman is a giving up of identity, and that can be very difficult.
Also, as the breadwinner, it's difficult.
Yes. Mm-hmm. So I think that, number one, destigmatize it. Number two, connect people with professionals that that can actually help in a meaningful way and that understand the disease process and the psychological ramifications of it. But I don't know how to vet those people. And I was surprised to hear earlier that there are therapists or social workers out there who would give advice to never leave a job. That surprises me, and I don't really know what to do with that. So I would say just connect them with any mental health professional. But it sounds like that's not the answer. There needs to be some other layer of, it needs to be a mental health professional that gets it. And I don't know how to vet those people.
So going back to where you started from with the support groups, different support groups, and having different ones for patients and caregivers and all of that, do you have any thoughts on how we would implement that? Because that kind of goes along with if you're feeling depressed, where do you have to go,
Yeah, so I mean, we floated some ideas around in terms of perhaps, we could have some professional facilitator at the beginning, and while community members are learning some facilitation skills to make it more autonomous eventually later on, and probably over something like Zoom, because that's just the most accessible format for a lot of people right now. But I don't have CADASIL, and no one in my family has CADASIL, so I don't know what's best for the community. So my ideas are limited.
I have a couple more thoughts.
I love it.
I wonder what it would look like, or if it's even feasible for us to have to stand up some sort of a mentorship program or some sort of a matching program for mental health professionals that are out in the community that are accessible to people with CADASIL. Is there someone that we could send them to? Is there maybe at the mothership there's some sort of I say mothership like
training?
It's some sort of a training or a basic educational kind of outreach resource that could at least be someone who could advise mental health professionals out in the field that are being asked to help CADASIL patients. Can they go to a resource and learn about CADASIL and what the particular needs of CADASIL patients and their families are, so that they can better support them in their own communities?
You don't need to go any further than Jane Paulson, because I was talking to her, and they did this for Huntington's. They actually set up educational programs for caregivers, and it worked, apparently. People would come and learn about different aspects of care for Huntington's.
Okay, yeah, do whatever they did.
I'll also say that I know that Dr. Paulson is trying to take kind of that educational model and bring it to different healthcare communities around the United States. So she's prepared an educational thing for healthcare providers that basically teaches them about CADASIL and how to recognize it. And they're currently working on implementing it. I believe she's going to St. Louis in a few weeks to give a talk at Washington University in St. Louis. So it is something that we recognize and we acknowledge that, not just neurologists need to know about it. And she's working on an educational program for it.
Do you want to pass that along back to Erin?
Yeah.
I guess I have a couple of thoughts. I don't know if they'll tie into what's being talked about right now. There was a couple. First of all, I have CADASIL. I'm not not medical profession at all. And there was some comment about hope. A couple of people have talked about hope before. For me, in terms of being diagnosed with CADASIL, the whole reason that it came about to my knowledge is through my brother, who is 6 years older than I. And I'll say that I'm now 73. I've been aware somewhat of a somewhat degree of something in my family that was not normal. People in my family talked about my grandfather, and he was not normal. And I'd hear stories being told about him where there would be people in his home, and he would be sitting off in the corner just ignoring everybody else. Anyway, I heard other things. When it comes to hope, when I first went to see a neurologist, he asked me how I thought he might be of help. And I told him, I need hope. Of all the things, prescriptions or medications, I will take them perhaps, but I need hope. And he ended up giving me hope. And the other thing I want to say is that this conference, for those out there that are listening, I consider this conference all the variety of people that are connected, either have it or have been doing research for CADASIL. This conference is very much a bringer of hope. Just to be able to talk to others, to be able to learn more about it, because after my brother had CADASIL, his wife was in the medical field, and she provided some things, an overload. I was reminded when somebody else was talking that you don't want to hear all negative things. You need to hear positive things and things that bring hope to you. And my wife, since we're right here, she is a provider of hope, and she's been very patient with me. So anyway, I hope I've affirmed the conference or spoken highly or well enough of the conference and the people that, and this is not the first year that I've been at this conference. People need hope. There's answers. It may take time. I still hope for a cure, and I hope also for a cure for my 3 kids, which are, they are concerned about. They didn't initially have kids right away because of the factor of, is this going to be shared with my grandkids? And I've got 6 now, so I'm thankful for that. I'm done now.
That was really beautifully said.
Kind of going back to Barb, is there something in the
I
chat?
was just going to read a comment.
Okay.
It maybe can add to what you just said from the McCoy family. If it helps anyone, my mother was diagnosed with MS over 25 years ago before there was much knowledge about it and she was so distraught because there was no information whatsoever, and the way she got through it was to set small milestones. And every time she met one, she would make another. Today, she is 64 and still going strong, and now takes medications that help prevent progression that were not even possibly heard of years ago. So there is definitely hope.
I just want to say thank you for that, Jennifer. This is my sister-in-law. I love you very much.
And just kind of going back to what Barb was saying, and anyone can interject, I love how the flow is going, but if we were to do some kind of support groups, what would you guys want to get out of them? What do you guys, or not that we would kind of conduct them, but help facilitate them and set them up? What is lacking? What do we need? Would you guys want it kind of stratified in different ways? I mean, this is worth.
I wonder what it would look like if the support group also had a program where you're matched with another person. So if you're newly diagnosed, could you be sort of offered the opportunity to be, like a big brother, just have someone whose rodeo they're not their first one, be connected with someone who was diagnosed maybe years ago that could help with just listening and being there, and just so people know that they're not alone, that their experience is not, their experience is unique to them, but they're not crazy. they're not off base. They're not going down the wrong path. They are okay as they are, and that every day's a new day. Some days are going to be a struggle. Some days are going to be easier, but every day you have access to someone who has been there and done that and can just hold your hand sometimes when you need it. So someone who could be accessible to you in an ongoing way as a person who's newly diagnosed. And then maybe after you're the newbie for a year, then you become the person who brings the next one along.
The sponsor almost.
Yes.
Yeah.
So to implement something like this, just a thought, could it be done in such a way of, say, Cure CADASIL Facebook page, putting a post? Would you like to join? I don't know, can decide at a later time who's going to be involved in it, if it'll be just patients, if it'll be caregivers, if it'll be just, maybe the first one will just be a public to have everybody join, and then we can there announce other ones for more specific groups. And then if Cure CADASIL posts it on their page, I will share it. And I have 900 and something friends that all are related to CADASIL, so hopefully somebody will see it. Just a thought.
It's great.
Something else that I thought of before that I should say is that one of the facts about the conference and about seeing someone that has specialized in some fashion in the medical profession, like a neurologist, and not all neurologists they may know something, they may have heard of it, but they don't know as much as, say, a professional CADASIL neurologist. The fact that if you have CADASIL, you may not have it to the degree that somebody else in your family. And I've had depression, but part of my problem with having depression is that my brother, who was diagnosed with CADASIL, he had depression. And so my father, I believe he had depression, or I believe he had CADASIL, because my brother, it's a genetic disease that I have, and you have to get it from somebody. But not everybody in the same family has CADASIL to the degree that somebody else, or somebody in the community. There's different complications, different diagnoses. Anyway, so.
Yeah, you're so right about that. It looks different in every body, and even among siblings, it can look very different. And that's being able to recognize that and understand it, especially if you're someone who's going to be matched with a newly diagnosed person, to be able to articulate that and provide that support and say, okay, yes, this can look very different between you and your brother, or you and your sister, or you and your father or mother, or what have you. And so their experience is not necessarily going to be your experience, and yours isn't necessarily going to be theirs. But it would be nice to know what you can do to maximize or optimize your life. So maybe that's another resource that we can dig into too. Is what are the top things that people can do to live the best life that they can? And I think that I heard earlier that stress reduction is one of the things that's kind of top of the list, and that's kind of un-American. So we'll have to turn that upside down, I suppose.
Well, I was just gonna, in that, my kids were told, just because this is the way the disease is going for your dad, please do not think this is the way it's going to go for you if you were to have it. New advances are coming all the time, and it is so different between family members. So, and that was kind of a hopeful thing too, because Tom got hit hard with it, and it just didn't. It was relentless. But that was, we kept driving that home, that just because it was like this for him, and if you do have it, it doesn't mean that's going to be like that for you. So don't get in your head, try not to get in your head about it, because you can, do yourself more harm than good. So, yeah.
Just to tag on to that, there's so much research about what your beliefs do to your outcomes. So if you believe you're going to have a bad outcome, then you're more likely to have a bad outcome. If you believe that you're going to have a good outcome, then that's more likely. So that's so inspiring hope, just like you said earlier, is just so key to helping people live the best way that they can.
Yeah.
I think. Somebody better take this mic from me because I'm using it.
It's hard to have hope when you know that this disease is in your family, and people, they died having depression, they died having what? I can't think. That's dementia, and seeing that and seeing them die with that depression and with that dementia is very hard. So.
So I was wondering if Cure CADASIL then would be willing to initiate a post on Facebook, just let's run along with this, about a support group to zoom in on.
Sure, it sounds good. I'm not a Facebook person myself, so I qualify my response. But we've talked a lot about getting more out there on social media. And the other thing we want to be very cautious about is being factual, not trying to give people false hope but not false hope kind of thing.
And so is this something maybe at the next CAG meeting, is this something we could help you with? If you say, I'm not really on Facebook, but I
Right.
just think I go right to Key. She's just like amazing on all the social media. Is it a conversation we could have that, yes, we would like to, I know many people would like to have support groups in their local region. And I know back in North Carolina, Tom and I actually did go to a support group. And so there, at that time, back in 2016, there were like little support groups, but if we could do it via Zoom and get a lot of people involved, and then they don't maybe feel so alone, or maybe, hey, this is what I do, and it takes you off in a whole other way of maybe dealing with things. So maybe that's something we, as the community advisory group, could help Cure CADASIL with.
Sure. Yeah. I mean, we'd have to see what it looks like, and for sure. Yeah.
Something that Barney said triggered something in me, and that's that I think that it's really important that we provide some resources to children, especially underage children of people who are affected with CADASIL, especially those who are experiencing some difficult outcomes early in life.
I might get emotional here. So I'm a 45-year-old woman sitting in front of you. But part of me is still an 11-year-old girl who watched her dad have a stroke and struggle and eventually, I'm sorry about this, but eventually die at a very early age. And it was extraordinarily difficult to watch as a young person. And as you can well see, that's had lasting consequences on me as an individual. So I think that it would be a really wonderful thing for us to do to provide some special attention to those individuals with CADASIL who do have young children, to support them, because they're going to see things that they can't unsee at an age where it could be very traumatizing for them.
And kind of getting into the logistics of these resources, how do we go about making them? I mean, I haven't had lived experiences. Those who have are the experts, in my opinion. It's not, us working necessarily in research who are the experts. It's the people who are experiencing these things day to day. Do you think there's, crowdsourcing? Is it kind of a collaborative effort between folks who are kind of on the professional side of things and in the community? I really don't know.
You can certainly talk to the ULF because they've been getting into this, I know, and they've tried to do monthly support group meetings for caregivers, for example. And I don't know exactly how far they've gotten, but I know they've talked about providing sibling support for, of course, a lot of the leukodystrophies are in pediatrics, but to pay attention to the siblings of, kids who've had leukodystrophies. In fact, I think was one of the stimulus behind the pizza night they had the other night for teenagers. And so I would talk to them. I don't know who all in the organization is doing that, but I know there's a lot of interest.
I'm sure Keely can point me in the right direction.
Was I correct in understanding you that Dr. Paulson has implemented a lot of the things we're talking about here for Huntington's? Is that?
Yeah, so for Huntington's, it's been a more established.
Can you pass this?
So for those of you who don't know me, my name is Abigail. I'm a research coordinator for CADASIL, but I also run Dr. Paulson's Huntington's study at UW-Madison. And, Huntington's has been around for much longer than CADASIL, so it's definitely much more established. And HDSA is kind of the Cure CADASIL equivalent, and they, similar to Cure CADASIL, provide lots of resources and that sort of thing. They have a social worker in every single state that runs support groups for different stages as well as for caregivers. But also Dr. Paulson worked at the University of Iowa for several decades, which is a center of excellence for Huntington's, and helped them to navigate a lot of these changes and sort of growing pains that CADASIL is now experiencing. So she definitely has a lot of experience in it, but again, to some extent, we are researchers, so we are kind of I don't know, it's a different, we're not having the lived experience or the kind of emotional connection that, say, a psychologist or a genetic counselor might have. And we really want to emphasize that, you know, these supports are not just for research participants. We really want to emphasize that it's separate from the research. You don't have to participate in research in order to benefit from this, because we recognize that not everybody can participate in research. Sometimes people are ineligible for various reasons. So, yes, to answer your question, Dr. Paulson is definitely, you know, a wealth of knowledge and has several decades of understanding about how to sort of grow and raise awareness for various diseases. But Huntington's is also, you know, a very different disease from CADASIL. So some of those things are, you know, not the same. It's also, you know, not as rare of a condition as CADASIL. It's more commonly covered in medical school curriculum. So.
But there are similarities to it also, you know.
I mean, it can cause dementia. There can be some motor things. There definitely are psychiatric symptoms.
I think the fact that it's genetic.
It's genetic. Yep, it's autosomal dominant.
You know.
50-50 chance.
Right.
So, yeah, there are a lot of similarities, which is, you know, part of the reason why Dr. Paulson kind of came down this road of sort of, we're still doing a lot of work on Huntington's, but she's also kind of expanding into CADASIL, because there's from a biological and basic science point of view, there are a lot of similarities.
So is it okay to say then that Dr. Paulson would be a wealth of information for us? And
in many topics.
A great contact for us to go to?
I mean, we've been in discussions with her about support groups, and she even offered to moderate the first couple of them because she is a clinical neuropsychologist. So, and she has experience in doing that with Huntington's disease. So, you know, we have been discussing kind of what it would look like, how frequently we would meet, the types of stratifications. You know, we would definitely want a separate caregiver group, but then it also kind of, I guess I would pose this to the CADASILians in the room of, is it a barrier to you to have, you know, a CADASIL-wide support group, CADASIL positive for Notch 3 support group, you know, to have people who are asymptomatic and people who are further in their symptoms? Would that be something that you would prefer in a support group? Would you rather that there be symptomatic and pre-symptomatic? You know, it's just that this is why we're opening it up to you guys, is we don't know. And so we really want to ask, like, what would make you feel most comfortable? How would you get the most out of this?
So it seems to me then like the first step is to get a general support group and then find out from the CADASIL community what the patients would want, what type of patients they would want in the group, a caregivers group, you know, a lot of the things that you talked about, if we could implement them.
Yeah, like for Huntington's, for example, it's most of the HDSA support groups, they're sort of a pre-symptomatic, you know, newly diagnosed, mid-symptoms, and then kind of late onset.
Yeah, I think a newly diagnosed group is probably a given, you know.
Or even you know, Michelle McGinnis is a wealth of knowledge on the people who choose to not know their status.
Right.
So that's also
another group,
another group of people. So we're not trying to, you know, limit it too much. We understand that there's only so many people who would be willing to attend a support group, so we don't want to, you know, make 10 and then 2 people show up to each one. But
Oh, just to add into that, so you don't have like 10 support groups and 3 people show up, could you do a quick survey and put it out in social media? Would you be interested in attending an online support group? And who would you like in there? You know, or, you know, and, you know, of course, where do you live? That's probably important. But, you know, what region are you from? Would you be interested? Well, yeah, but sometimes if it's dinner time, like, you know, it's 3 p.m. my time, dinner time, their
Time zones.
you know, maybe break it out like that, and then maybe they, I know, my mom, dinner time, but, you know, and then as they get to know, maybe if it's in a particular region, or then, then that might lead to in-person meetups, which would be phenomenal, like this, you know. So maybe just a little survey to see what people are interested in, and formulate it from there.
So that's definitely something that, we're interested in. We want to collect as much information as possible, and we would definitely be relying on Bert and Cure CADASIL with that, because as researchers, we are also, somewhat limited by regulatory things. So it's very complicated, and we don't always understand, but, we want to make sure that this is as accessible to as many people as possible, and for people to understand that they don't have to participate in research in order to benefit from it. So that's why it's so valuable to work with, advocacy groups like Cure CADASIL.
So kind of to not quite wrap things up, because we're all staying in here for the social half hour after, but to kind of think about action items, and I don't want to miss anything, because I think that, for us to kind of go forward and implement some of these ideas we've had in this, we kind of need to summarize them. So kind of support groups seem like something we're interested in, and maybe to start and kick it off with a general one, kind of open to the entire community. Introduce it, put feelers in, maybe have a survey both in that kind of initial group and then afterwards too, to see, kind of give it a while to see kind of the feedback that we're getting from people who might not have been able to attend that initial one, or might not have felt comfortable speaking up during that initial one. And that seems like one of the actionable items that we could kind of collaborate with. Another one sounds like this almost sponsor or mentorship program we could look into creating, where we could match up either individuals or families. And then kind of a third one that came up would be like a newly diagnosed kid, kind of what to expect. Is there anything else that we can also work towards and that's missing, or do you guys want to flesh out some of these things a little bit more?
I'll just say for the kit, I wrote down some of the things that Erin and I think also June had mentioned. So I'll just read them out, and if there's anything else that you think we should add. So kind of simplifying medical terms to make them more approachable to the common person, how to find care and get in contact with a neurologist that understands CADASIL, connecting with Cure CADASIL or other similar resources that have a wealth of information, current research studies that are available, common symptoms or things that people experience, kind of similar to that chart that Dr. Elahi showed earlier today, and then a list of sort of vetted documents that somebody should read when they've first been diagnosed with CADASIL on information, what to expect, that sort of thing, that are informational and not just negative or defeatist. Anything else?
Or maybe, I'm sorry, maybe,
No, go ahead.
maybe you already said this, but for the patient and then maybe for the caregiver, could there be like a list, just a checklist? I have some, not going to see the doctor for 2 weeks, but this is on my mind right now, and I want to maybe write it down, check it off, and then just to reinforce that you want to bring it with you, in your little kit. If you are having anything that you just have a question about, you can have a little checklist. Make sure you bring it to the doctor, because time is very limited, and this is, or I want a medication is not working, or I'm feeling funny, or because I think sometimes, and I know it was, again for Tom, when he'd get in the office, he wouldn't say anything. And then when we get out, he's like, geez, I wanted to ask about this. And I said, well, why didn't you? Well, I didn't want to bother them because I know they're really busy. So it's like, okay, but let's get this written down. And then, and also we, with the neurologist and the primary care physician and myself, Tom had strokes that ran the gambit. Sometimes he had to go into the hospital. Sometimes we could ride it out at home with just a doctor's visit. So to make sure you talk with your doctor to have like a little game plan. If X, Y, and Z is happening, then yeah, you may want to bring him in, or this just warrants a phone call, or to give just guidelines for the caregiver, or if you're dealing with this on your own. Because in the beginning, I know for me, everything was an emergency. And so just to kind of get you through that in the beginning, and then you kind of get into a rhythm of, and then you know what, okay, he can probably stay home, I'll call the doctor in the morning. So just kind of like maybe guidelines. I'm gonna give this to you.
Final thoughts that I have. If there is to be a care group or group of people connected in some way with CADASIL, don't feel that it has to have all the perfect answers or all the right answers for everything. In order to care, you need to express that care in some action. But we don't, everything that we do is not all done exactly the best way. And we can make mistakes. And I think that's something to remember. Reach out and do care.
Thank you.
Perfect.
I also realized I missed a couple of other things that were mentioned in terms of educational materials for children and parents with children and how to explain it, as well as educational materials for professionals such as mental health professionals about CADASIL. And if you are working with somebody with CADASIL or affected by CADASIL in some way, shape, or form, kind of a rundown of all the information you need to know in order to do the best work possible. Is there other ideas? We can continue to develop them, see each other next year, have a full checklist, all boxes checked off.
There was that tiny little thing about embedding a clinical decision support tool.
Yep. An Epic.
EMRs. I mean, that might not be super easy to do. It sounds really easy, but it might not be. But it would be enormously impactful if we can pull it off.
And I was also thinking, I don't know if this would be something beneficial, but what about regular stories of hope? Like if we were to do some kind of social media campaign or something to share, you guys are inspired by each other, I'm inspired by you guys, and how do we get that outside of this room? How do we get it to everybody in the community?
So through Cure CADASIL, key
Oh, yes.
initiative.
Yes, I
Project
know them.
CADASIL.
I know
No,
the faces of
The faces of CADASIL.
Yep,
So,
yep.
but even maybe taking that a little more. I know on Cure CADASIL at one time, and maybe it still is, share your story. So really just everyone has a unique, beautiful story that needs to be told. And so, we send them to the Cure CADASIL website where they can send their story. Do you be in touch with Key? Key's in charge of getting out the faces of CADASIL. And, Key will post that, something like that. Yeah.
So kind of along with the faces of CADASIL,
Yeah.
maybe have an adjunct kind of stories of hope, or
Yeah.
even I know that the face of CADASIL are quite, they're not super long, but they are in depth of the stories. Even just kind of like little blips of hope. What made you hopeful today?
Right. And, maybe that is something that can go out through Project CADASIL.
Yeah.
Maybe set up on a regular basis where, every Monday it's, this is just a great story about someone in the CADASIL community, and maybe Key could set that up. Of course, I'm speaking for Key, but, maybe we could, maybe something like that could be set up where just encouraging people to tell their stories and, how they remain hopeful and, what they do to kind of get through the day or whatever. And then, maybe we could schedule it to just go out every once a week or something like that.
Anything else in the chat? Well, we are 5 minutes before the social hour, but thank you guys so much. I truly appreciate all of your input and all you guys do to strengthen yourself, your families, this community. You guys are truly inspiring. Thanks.
Thank you.
Thanks, Colin.